Hello, welcome to another episode of the Lifestyle MD. I am Dr. Angela, and I am so excited that you have joined us today. And by us, I mean me and Dr. Carrie, a return guest, one of our favorites, and the other half of West Michigan Wellness Partners. Holla.
Woo!
Yes, and we are so excited to collaborate on a series around perimenopause and menopause. So Dr. Carrie, just to remind you, is a licensed naturopath and she owns Vibrant Wellness. And as I mentioned, she is my partner in West Michigan Wellness Partners. So Dr. Carrie, thanks again for joining us today. I'm so excited about this episode. We've talked about this for a long time.
We have. Thank you so much for having me again.
Of course, of course. I get so excited when we're talking. Okay, so let's tell our listeners what are we covering today. You're going to be talking about perimenopause and menopause, but specifically, we're gonna we're going to have three episodes in this series. The first is going to get around defining what that means and what the transition is and what it feels like for women to help explain what they're experiencing. Then episodes 2 and 3 are going to get into lifestyle and natural approaches to managing those symptoms. And then the third one is going to get into risk and benefits of HRT or hormone replacement therapy and what you should be thinking about if you're looking at that or you are taking hormone replacement therapy. So, in this episode, we are going to cover as much detail as we can when the time we have without stepping on our own toes because we do have a workshop coming up. So, Dr. Carey, tell our listeners about this workshop.
Oh, yes. So it is going to be a deeper dive into perimenopause and menopause. I believe it is, let me grab the date. It's the 21st of July. And yeah, we're just going to be talking more about perimenopause and menopause and expounding upon our series that we are going to be doing on the podcast too. So.
Yay. So, there's so much to talk about, and this is such a big topic. We're passionate about it because, well, for one, we're women, right?
Mhm.
We are actually kind of in the throes of that perimenopause transition.
Mhm.
And I feel like just being in this transition has, for one, heightened my interest in it. But even more so, before I entered this transition, I was having these conversations with patient after patient after patient for a very long time. Would you agree, Dr. Carey?
I do agree. Also, too, the other thing that I always think about is how we have lost our passing down of knowledge in
Yes.
our society specifically. Really interesting. I was watching a video of a clip of Trevor Noah talking, and he mentioned how as industrialization happens in a country, community becomes less and less. And so I think
Yes.
that's a big piece as to why we don't talk about these things is because we are less community based nowadays. And so anyway, I definitely approached Dr. Angela and I was like, we need to do this. We need to be able to like facilitate these conversations and make this information available to people because we're doing ourselves a disservice.
Right.
And we're totally missing out on the wisdom that our older female family members and loved ones and whatnot have to share, but don't necessarily have again, a space to share it with younger women. So,
Right. And how that looks for us is women coming into the office who have entered this transition and are puzzled about what's happening to their bodies and the changes that are happening because no one's ever talked to them or shared their experiences with them. I'll ask women often, and you'll understand later why this is relevant. What was your mother's experience like? And it's like, well, I don't know. I never asked, or so and so never told me. I just had that happen yesterday. So it's really interesting and it's also universal. You and I have echoed the same sentiment over and over and over again about how many women just don't know.
mhm.
And so we are really passionate about providing holistic and comprehensive care. We're really passionate about helping people navigate their health and being empowered,
Yes,
right? And so
yes,
our goal here is to empower you with knowledge because this doesn't belong to us.
right.
This
We're not,
belongs to, we'll cover some common symptoms. There are some things that we're going to leave on the table for the workshop. We'll let you know more about that when we get there. And then why is this misunderstood? Why are so many women confused about this? Like what's happening or not happening in the healthcare system? So let's talk about that. Let's throw the healthcare system under the bus a little bit, right?
like,
Um, Mm-hmm. I don't have a problem doing that.
I don't either.
And reframing what this season is for us, right? Because it really is about reframing. And then we'll give you a little sneak peek about what to expect for the next episode. All right, so let's get into defining what these stages are. So can you go ahead and share your screen, Dr. Carrie, so that
Absolutely.
we can talk through the stages?
Sharing now.
Ah, beautiful.
See if I can. Does that make it bigger?
Yeah, that's bigger.
Okay.
I'm going to move my video down here. Perfect. So go ahead and talk us through what's happening here in this diagram.
Absolutely. So the first section on the left-hand side is premenopause, right? So this is active menstruation. And you can see that it's pretty cyclical, right? It is pretty regular. You see different peaks of estrogen, different peaks of progesterone, FSH, LH, and it is happening on a cyclical basis. Regular intervals, that's what happens during menstruation. That's why your period is a cycle.
So for people who can't see this right now, it's literally like an up and down, peaks and valleys, peaks and valleys. And it's, you have your periods, you have, you have your ovulation. Yeah. And then you have like your tired rundown period or time. So anyway, the peaks and valleys. So
Yep.
we did a whole workshop around that. So we'll make that available at some point. So that's the first part, premenopause, or what we also call reproductive years, right?
Yep. Then the second phase in the middle is entitled perimenopause. And FYI, peri meaning surrounding or around, right? So we are nearby as
Mm-hmm.
menopause. And so for those who can't see this graph, this is just a haphazard mess of peaks and valleys and squiggles. There is no regularity to it. There is no rhythm. It is just a mess. I like to think of, if we shift back to the pre-menopause picture, I like to think of this like a song, if you will. It's almost like we're
Mm.
reading music. Think of this as like music on a I don't even know what they call that anymore, but like written out music. There is like I said, there is regularity in it, but also it is, if you imagine each of these hormones as their own instrument,
Beat. Yeah.
or yes, instrument
Mm-hmm.
and beat, right? It together they create this beautiful harmony, which
Yes.
happens again when things are balanced, your hormones are balanced, and you're having
It's like I imagine like a conductor in a symphony. Like, and if you've
yes,
seen different arrangements, this
yeah,
would be the type of arrangement that's really smooth and has like clear ups and downs, and the conductor's movements are predictable.
yes, that's beautifully said. I like
Thank
that.
you.
Now, right, let's take that same
Yes.
analogy into Perry. So now that you said conductor, it's almost like I hear Flight of the Butterfly
Yes, exactly what came to my mind. Flight of the butter or Flight of the Bumblebee.
or Bumblebee, thank
Yeah,
you.
Flight of the
In the
Bumblebee.
background, in my head, right? It's just
Yes. If you can imagine what that conductor looks
he's
like, right?
all over the
He's all
place.
over
He's
the place.
crazy. Uh,
Yes.
and so
What the
again,
heck's happening?
why is it like this?
And what I really like about this diagram, and I'll make this available in our podcast notes some way or another, is the fact that you can really appreciate why your doctors and your healthcare providers say we can check your hormones.
Mm,
I can tell you if you're likely perimenopausal, like we can see ratios and that kind of thing, but it's not a clear picture of what's happening because there is no consistency during this phase,
right.
right?
Right.
So it truly is a snapshot in time that's not incredibly useful. We know by symptoms, we know by roughly the ratios of the hormones relative to each other and age. I think I might have said age already, where you are.
Mm,
When you hit that next phase, the final one, postmenopause, why does it say postmenopause and not menopause?
I don't know.
I just thought about that. Well, anyway, once you hit menopause,
Right.
then it just kind of reaches a plateau. So explain what's happening next.
So once you get to menopause, you see the two primary hormones, in the green being estrogen and the very dark blue being progesterone. They're just bottomed out.
Mm-hmm.
But they're stable for the most
Yes.
part, right?
Yes.
So where perimenopause is a time of variability and
Unpredictability.
unpredictability, come on.
Mm-hmm.
Or menopause is a time where finally things have kind of stabilized, even though, depending on your individual circumstance, you may still have symptoms. You may still notice some things persisting. And again,
Yes.
that's when you want to find a practitioner like us that will help you um, with your individual picture.
Yes. And when you've reached that phase of menopause, it's like the winding down. Like it's where you might see the conductor cueing, a percussionist, or cueing the lead violinist, or cueing the lead cello, and they're just kind of like everything is quieting down.
They're doing their solo a
They're
little bit.
doing their solo, right? And it's kind of like it's literally winding down. So,
Mhm.
and everything is very quiet. So that's it's really a magical time, I think, for a lot of women, because you feel the most consistent you've probably ever felt in your life.
Mm. This will be, and that's really interesting. I don't even know if women recognize that.
I've talked with women who've recognized it.
That's good. That's good.
Yes, yes. And those are, but they're I mean, they're all much older. There's
Right.
a big difference. And so I've had these conversations around menopause and perimenopause with my mother. I mean, not intentionally, but from early on, because my mother actually had premature menopause. And
Mm.
so I was keenly aware of all these things. And for a long time, I irrationally thought I was going to have the same thing, but I didn't have surgical menopause. Like like I'm going naturally through the process. So my experience is vastly different than hers, but I witnessed what that was like for her. And I've had the luxury of having conversations with people in my network, but also with my patients. I've Many of the women who are our age, like in their like late 30s, mid 40s, late 40s, are kind of seem to be in a generation of less knowing and less understanding. I think people are becoming more aware courtesy of social media,
Yeah.
but it's that older generation, many of which who have passed on or near the end of their life, that really
They got the
that
knowledge.
got the knowledge. Yeah. And I don't really truthfully know, again, 100% why it's that way. And you and I have alluded to that, and maybe talked about, like, there's just more community. There was less distraction. People were engaging more. There was more time for
Yes.
conversation. And
Yes.
when
There was
you
more.
actually, yeah,
Yeah.
more depth, right? All right. So we can take that off the screen.
Oh, thank
Or
you.
do we want to? It actually might be helpful to
Want
leave
to
it
leave
up.
it on? I will say one
Yeah.
last thing too. I
Yeah.
didn't
No, leave it on
explain
there.
these other two hormones. So I talked about
Yeah.
the estrogen and progesterone. The other
Yeah.
two, FSH and LH, are more related to ovulation and like preparing the egg, but those go up, and they go up because your ovaries are no longer responding to those hormones, and it's your brain still trying to get the egg to be matured and then erupt through.
Yeah. FSH and LH are coming from your central part, your brain, and it's trying to tell
Your
the
ovary.
organs, your ovary, to do its job. And it keeps yelling, do its job, do your job. And it's down there like, I can't. I
Ovary's
can't.
like, I'm done.
I'm
I'm
done.
clocked
I
out. I'm
am
clocked out.
done. That's it.
I'm
I am
clocked out.
retired. I have done all I can do. That's it. And in fact, perimenopause might be like that teacher that's lost their edge.
Oh, yes, very volatile.
Very
You never
volatile.
know what's gonna set her off or him.
I mean, so speaking of him, this is not the topic here, but I recorded an episode before this with another guest, and we talked about andropause.
Mhm.
So sad that it didn't record properly. I'm going to have to see if there's any way I can rescue it. But men experience something similar, but it's a dramatically different experience for them. So I'm not going to talk about that here. I think that may be something that we can bring up in our men's health talk
Definitely.
that we are doing next week, Monday. It's around the
Yeah.
corner, talking about andropause. I didn't include that in our slides. I'll have to add it. So coming back to that whole community thing, and how it, I was really struck by the fact that whether it's with doctors, with friends, colleagues, people don't take enough time just to talk and be present.
So true. So true. And it's sad
Mhm.
because that's what we as human beings on a base level, that's what we do is
Mhm.
we're a community. I don't like to say we're animals, but we very much are animals, and most mammals are family unit, community-based beings, and we are
Right.
too.
Right.
And so I
Yeah.
definitely think it is doing us a disservice in multiple areas, but specifically for our health, because in naturopathic medicine, we look at community as part of the determinants of health.
Mm.
We see it a lot with older folks,
Mhm.
when they're isolated, especially if they live by themselves and they don't have community, that's when their body starts to really go down. And I think again,
Right.
it's important. Um,
And it's one of the things that goes along with lifestyle medicine too. It's, we've talked about this in other episodes, purpose and community,
yes.
just going together. And when we saw during COVID what that did to so many people, especially our elderly. So, I mean, that just kind of brings the point full circle as we're going through changes. So you can see the hormone fluctuations. You go from steady, repeatable, it's cyclical, but it's predictable to unpredictable and erratic to another steady state, but a new norm.
Mhm.
And each one of these phases is going to feel different, and your body's going to behave differently, respond differently to a whole slew of things. And you are more vulnerable to certain things later in life than you are early in life. And these hormones have a lot to do with it.
Yes.
So, quickly defining. So, premenopause, reproductive years, that's when you've got stable, predictable, cyclical, monthly, more or less, estrogen and progesterone fluctuations, which are managed or kind of triggered by FSH and LH.
Yep.
Then you have perimenopause, where you have more fluctuating levels, more volatility, and ovulatory cycles, which means that you're going to have less predictable periods, maybe longer cycles, shorter cycles. And then menopause, where your ovaries completely stop producing, in other words, ovulating. And that leads to a dramatic drop off in your estrogen and progesterone. And we define this in medical practice as 12 months without a period. So we don't technically need to have hormone testing to confirm
True.
that, by the way. If you
True.
haven't had a period in 12 months, you're menopausal.
And it
Uh,
is so funny. I just want to say, my clients, some of them get so upset because they'll be like,
mhm.
that's 11 months down. Like,
And then,
no, one more to go. And then here comes the period out the blue
ah,
somewhere. And they're
it's
like,
so wrong. It's so
oh,
wrong. It's so wrong. And I do believe lifestyle factors play a big role in that, right?
absolutely.
So we'll
Absolutely.
get into that later. So you can have an influence on that in a positive way.
Mhm.
Then we have postmenopause. And how is postmenopause different than menopause? I don't think I ever fully understood that, to be honest.
So I think menopause is less volatile than peri, but
Mm-hmm.
again, you can still have symptoms that are happening, especially the
Mm-hmm.
hot flashes and the night sweats. Like that's just like paramount. But I
Mm-hmm.
think postmenopause is almost like a stabilization where
Okay.
this is when you were saying this actually relates to what you were saying when you say the women can feel the best
Mm,
that they have felt, right? Because finally
mm,
these hormones have kind of settled, if you will.
yeah, that makes sense. And it's almost like the menopause is really kind of like a brief transition. It's like ovulation when we look at the
The whole
cycle. Yeah, yeah. So it's a transition point before the final shift, right? Yeah,
yes.
that makes sense. So the big changes here is really the estrogen and progesterone. That's what we're going to mainly talk about. Testosterone also declines, right?
Mhm.
DHEA as
Mhm.
well. These are some things that we'll get more into in our workshop. If you want to participate in that, by the way, I'll include a link for registration in our show notes. But what are the high level impacts of declining estrogen?
So I want to think about it. I always explain estrogen and progesterone. I like to compare them. I explain estrogen is like the gas pedal of
Mm,
the hormones versus progesterone being the brake.
I
And
like that.
so
It's so good.
this will help you understand which
So good.
which one is at play, we'll say, in regards to your symptoms, or at least it helps me clinically figure that out. But when estrogen declines, right, you're definitely going to see the variability in the period. If it surges, right, that's when the hot flash might come. That's when the period that has been kind of slowly trickling off all of a sudden might become heavy again, or the cramping is um more painful. But the declining estrogen definitely plays a role on the irregularity of the menstrual cycle. Whereas when progesterone drops, then you start to see things go crazy or haywire a little bit if you think about it again with progesterone being the break. So progesterone can give you a lot of mental emotional symptoms, so it might cause anxiety, right? That's kind of like crazy, even though we don't like to use the word crazy. I can't think of a better word at this moment, but like your thoughts, you're anxious, you're hyper focused.
Untethered?
I like, ooh, untethered. I like that. But you just can't turn off that anxiety like you
Yeah.
typically could. Again, if
Yeah.
your hormones are balanced. Sleep interruptions.
Mm-hmm.
You might have insomnia. You might be able to fall asleep, but you might wake up multiple times throughout the night. Or you might have difficulty falling asleep as well. Again, it just
Mm-hmm.
depends. And then also progesterone definitely has a role in the irregularity of the cycles and the variability of the flow too of the period.
Mm-hmm.
So um I will say briefly, when testosterone starts to decline, then interestingly enough, libido tanks a little
Mm-hmm.
bit. And that is it's something that I have noticed many people don't understand, especially women or even men.
Yes.
They just
Yes.
don't realize how important testosterone is for women because all we hear about is testosterone for men. But
Exactly.
definitely libido, definitely changes with your musculoskeletal system because testosterone is so important for muscle
Mm-hmm.
development. But then also, too, testosterone does have some implications on your brain. And so you may
Yes.
notice
Motivation, drive.
motivation, yes, and just focus even too
Yeah.
sometimes.
Focus.
So,
That explains a lot.
mhm,
So
I know.
I think testosterone, when I think back to my training and my years in practice in traditional healthcare setting, that's something that's very seldom ever discussed about when women are going through the transition and just its impact on women in general. So definitely something that we're going to spend a fair amount of time, I think, discussing during our workshop. So again, I encourage you to sign up for our workshop, which will be virtual. So we'll get into more details about that. I also want to circle back to estrogen metabolism.
Huge, yes,
Huge, right? Huge.
yes, because of the weight.
Yes, exactly. So a common refrain I get from women is, well, doc, I'm gaining all this weight and I haven't changed anything.
Hmm.
And my response is, but your body has,
Yes,
right? And
yes.
so when you think back to this diagram, for those of you, especially you can see it, you understand why you're going to need to behave differently and why your body's responding differently at different parts in in your transition. So yeah,
Mhm.
there's a reason for it. So common symptoms that women are experiencing. So there are certain things that women are expect: hot flashes
And night
and
sweats
night sweats,
across
right?
the board.
Across the board.
Everybody knows that.
And there are some things that may be more subtle and where they think people will think, well, it's all in my head. What's going on? I don't understand. So let's break it into three categories. Let's talk
Mhm.
about physical, mental, emotional, and your cycle changes, which we've already briefly talked about. So what are some of those physical symptoms?
So definitely, like we just said, hot flashes, night sweats, also vaginal dryness,
Mm-hmm.
huge. Another one that can be overlooked very much is fatigue because there's
Yes.
so many causes for fatigue, right?
Yes.
So people might be going anywhere else
That's
besides,
probably one of the
you
most
know,
common things I get from women that are in perimenopause is that they're so tired all the time, right?
yes. And like you said, I didn't change anything. I haven't done anything different. I'm still going to sleep at the same time every night and getting my 8 hours and all of that. Why am I so tired?
Mm-hmm.
Um,
Mm-hmm.
others, like we mentioned, changes with weight and then joint pain too. Very common
Yes.
physical symptoms. One thing I want to just quickly mention, and this is something we'll probably talk a little bit more at our workshop, but we hear a lot about hot flashes. What you don't always hear about are cold flashes, if you will.
Ooh, say more.
So I don't want to because I
Oh,
want to
okay. All right.
share.
Hold that one for later.
But
Okay.
just know that it's not always hot.
Yes. And furthermore, it doesn't just happen at night, like night
Yes,
sweats. Like
yes.
it may be more disruptive at night because it's you can't sleep, but it can happen anytime
Throughout the day.
throughout the
Yes.
day, right? And there's again, teaser, there are natural things that you can do
Mhm.
to alter that, the frequency and the occurrence of said things, which we'll talk about in episode 2, in
Mhm.
our 3-episode series. So the mental and emotional effects, this category is another big one that I get from women.
Oh,
Like
yes,
again,
definitely.
they're not coming in necessarily for the hot flashes and night sweats.
No, no.
Nope. Because they know where that's from.
They
Like
recognize
they
that.
recognize it and they've either decided to treat it already or they've just decided to live with it. Or guess what? It's not always that bad for some
This
women.
is
That's
true.
another
Some
thing is
women don't have them at all.
don't have them at all. Menopause and perimenopause is highly variable. All
Yeah,
these things, you can have all these things, some of these things or none,
none.
right?
Mhm.
So, it is what it is. So brain fog.
Yep.
I get that a lot. What are some other things that you see from a mental and emotional standpoint?
Irritability.
Mm,
And it's
again,
so
that explains a lot.
and it's so interesting, right? Because that's also a very common PMS symptom
Yes.
when women are menstruating. So it's funny because they won't necessarily make that connection and they don't have to. That's why they come to us. But
Mhm.
it's different, even the way they describe the irritability now or when they're perimenopausal or menopausal versus when they were menstruating. Because again, it's more predictable when you're menstruating. I know that when I'm starting to get weepy and my husband is irritating me, oh, period's probably coming soon, right? If you're perimenopausal or menopausal, though, the irritability could be happening constantly. And so a lot of times they'll come
Mhm.
into my office and they'll be like, I don't know what's going on, but like I am just mean to everybody all of a sudden.
Mhm.
Or
They
I
like
just,
to drop a special word there.
yeah, yes, I didn't specifically use it. But right, I act like this all the time and I just don't
Yeah.
understand. And so with the
And it's
irritability,
frustrating too because they're like, I don't want to act this way. Like
right?
how do
We
I
were
change
at
it?
dinner, like we were having a good time. I don't understand
Mhm.
why I couldn't like bring my mood up.
Mhm.
But with that too comes other swings of mood. But the irritability piece, for some reason, at least in my patient population, that's the thing
That's a
that
big one.
and
And then like memory lapses, people will start having those memory lapses and being more forgetful and immediately jump to, oh, I've got Parkinson's or I've got dementia.
dementia or something.
Right.
Yep.
And again, I'm not dismissing, I think you need to have a comprehensive evaluation. If you're, don't just say I've got these symptoms and automatically chalk it up to perimenopause. Okay. So that's not what we're saying here, by the way.
Right.
Just highlighting that these things can happen. We encourage you to always talk to your healthcare provider
Right.
about what's happening so that you can have a very specialized, personalized approach to what's happening to get to the root cause. At the end of the day, if it's this, then great, then you know how to approach it.
Mhm.
But that can be a factor too. I forgot to mention too, joint pain
Mhm.
being worse, which is interesting. So we already talked about the cycle changes, but things I will often tell women is if you were think back to be when you first started having periods, when you had your first period. It might have been that you had one and then it was months and months before you had the next one, or it was like they were shorter, like you would have one every 10 days, or it was just less predictable. It was more
Mhm.
variable, very similar to what happens perimenopause.
Mhm.
And especially the closer you get to menopause, you are going to have either you might have shorter periods, You might have heavier periods. You might have longer periods. You might have more time between periods. It can look a whole lot of different ways. And that can often be a pretty telling cycle related clue that you're in the transition. So that's probably the most predictable thing that I can use to assess where a woman is without doing any testing at all.
Yes, absolutely. Absolutely. One other thing too that I like to tell women is don't be alarmed if your period is light the whole
Mm,
time, right? And it's
mm-hmm,
like you just have on this panty lighter and you barely have anything on the panty lighter. Like that's
mm-hmm.
okay. It still technically is a period.
Right,
It is just, again, likely during that time, your hormones were down, had shifted downwards, and they were less
right,
present during that time. So,
right. That makes sense.
but one thing I do want to just note, so we talked about physical symptoms, we talked about mental, emotional, we talked about cycle changes. And so it is important to note that menopause and perimenopause is a whole body change, a whole body transition,
Yes.
not just only affecting your reproductive system.
Yes. And which is again reminds me why this workshop is so important to us, because we're going to not just talk about these reproductive switches and changes that are happening, but what is that impact on everything physically and
Yeah.
everything mentally, and what do you do about it? It's so much more complicated. And really, women are just missing out on so much valuable information about what's happening to their bodies, right?
I hope one of the things I try to help women, and I guess this is kind of a good shift, is I want them to understand and appreciate their period.
Yes.
You know, it is the hormones that are driving your menstrual cycle are important, and they're important again not only
Mhm.
to your reproductive parts but to your whole
Yes.
body. And I know that it can be a trying time, and especially because it happens every month, but it is natural, it's normal, and there are benefits
Yes.
to cycling the way nature intended.
Yes.
Like that.
Yes. And it's a divine design. Okay.
Yes.
And it works the way it works. I mean, and that again, there are women who don't have regular periods for various reasons, right? So PCOS, stress, there's all kinds of factors. And again, that's not what we're talking about here. We're just talking about your typical standard uh, reproductive, perimenopause, menopause. Again, we can talk more about that in our workshop on a case by case basis, or you can um, schedule an appointment with either one of us for a consult. It's better handled on a personal, individual level, because that's very personalized care, right? Um, but there's intention behind it. These hormones are critical part. I mean, it's a part of your body that you cannot function fully in all the ways that you need to function if these things aren't happening. I mean, there's intention behind it. I mean, that's why you have different seasons. Your body is going to behave differently in different seasons. So anyway, just reiterates the importance of
Reinforcement.
understanding these. So medicine has not, and when I say medicine, I'm thinking traditional medical school, right?
Yep.
And the traditional healthcare system, your primary care doctors, um,
Your gynecologist.
gynecologists, and not a lot of that's been punted. Gynecologists are being forced to just do very limited care and specialized care and disease care, and aren't doing this proactive management anymore. So
Mhm.
it's not it's not really elaborated on. It's not discussed. Arguably not a significant part of training. So medicine has fallen short, right? And treats it like a disease.
Mhm.
And there's got to be medications for everything that's a disease, right? And
Mhm. Yeah, because
uh-huh,
the disease is a problem that we need to
uh-huh,
fix.
uh-huh. Or if there's nothing to fix and it's not a disease, you just have to deal with it because that's just what happens. Right?
Mhm.
You're a woman, that's normal.
Mhm.
Okay. There's things that you can do to optimize your well-being. So it's either completely dismissed or over medicalized is they're kind of
Yes,
like the two extremes that I see, right?
absolutely.
So there's a little bit of a lack of training. there's some transition to cultural silence, both in the medical community and among patients. There was, and I think actually, I think a lot of that what might have been maybe tampered by the Women's Health Initiative
Mm,
initial outcomes of those studies um, that initially a lot of the outcomes were, to not use hormone replacement therapy and estrogen replacement therapy because of a lot of negative risks, including increased cardiovascular disease, heart attacks, and strokes. And that study and those results, not necessarily that study, but those initial interpretations have since been revised.
yep.
And we can talk about that in episode 3 of this series. It's going to be a really good nerdy episode because I love talking about that. So a lot there's I think there's been a lot of misunderstanding, lack of understanding just flying around culturally and medically.
Yeah, absolutely. And a lot of the research wasn't even done on women for the
Exactly.
longest, right? So
Exactly.
there's a vacuum in even the knowledge.
Exactly. Exactly. I mean, how about the fact that even just understanding that not every woman's menstrual cycle is the same. I know I wasn't taught that.
No,
Or not
no.
menstrual cycle, but menopause. But
Both.
both. Yeah, both. Yeah, both. Exactly. It's just been underappreciated, understood, or just
Yeah.
neglected. Let's just say what it is. It's been neglected. And women make up a pretty significant portion of the healthcare force, especially primary care, preventive OBG,
Mm,
and OBG, OB-GYN. But now there's less time for
yeah.
patient care. And so everything is being, put into bite-sized, pieces. And basically, if you don't have a problem that someone can treat, then there's nothing to do there.
Yeah. And I personally don't believe that's practicing good medicine.
I
You're
agree.
not supporting your patients. If they're bringing a concern to you, and even if it seems like it's normal, that's partly, we talked about this already,
We
but this
talked about
part of
this.
the
Yeah.
reason why I went the way I went.
Yes. 100%. Yeah. And the reason why I left the hospital system and started my own practice, so that I can spend more time with patients. So I was having a conversation with my husband last night. I've been watching another medical show, The Resident, this time, and pretty good. It's about an internist. And this this one particular episode really hit me because I mean a lot of it resonates with me, but this one resonated with me because he had an encounter with a patient who had a problem that had gone undiagnosed for 10 years. And this patient had seen countless specialists and had been poked and prodded, and he had just resigned himself to suffer. And he was tired of being a pincushion and
Mm,
tired of being an experiment and having all the same things done over and over again. And so this resident, who was like a senior internal medicine resident, he he reviewed the guy's chart. He kind of like stole him away from all the doctors and attendings and specialists who were trying to schedule him for all these studies. And he sat down with them and he said, "Okay, look, I've read everything through your history and I've reviewed it. Now I want to hear it from you.
mm,
Talk to me. Tell me anything and everything. No details too small. Just talk."
yes.
And the guy was like, "What?"
Mhm.
Just like taken aback. He tucks away the chart, on his iPad, and he just leans back in his chair. And I'm like, like that's what I do in my office all the time. I'm like, okay,
Yes.
so let's just kind of go. No agenda.
Yeah, just
Where is
telling
this?
your story.
Just telling your story. And I had an attending tell me once that if you listen long enough, your patient will tell you the answer.
Absolutely.
And in this episode, the guy said about 90% of things can be solved just by listening to the patient. And I could not agree more. This is broad, much broader than perimenopause and menopause, but it applies here because I feel like a lot of women, especially the ones that seek us out, have felt like overlooked, gaslit about their symptoms, experiencing things that have been downplayed, like brain fog and excess fatigue, and that have just kind of been poo pooed and dismissed, and are having real symptoms, but no one's listening to them. And if you listen long enough,
Mhm.
you'll find out what's happening. You can get an answer. So if your doctor's not listening, I encourage you to find one that can and does.
Please find one who'll take the time, because I think that that's the biggest positive piece of the reviews that I get is thank you for
Mm,
just creating the space and
mm,
allowing me to share what I need to share, or allowing them to talk about whatever it is that they feel comfortable talking about at that time. And again, it goes back to that community thing. We don't have that anymore.
mm-hmm.
And obviously, as a doctor, you have to have boundaries, but you can still totally have regular human interaction with somebody. It's healing. So,
A big part of what I do at Seeds of Health is regular interactions with people. We have our walk with the doc that you and I both participate in on a monthly basis. And we have kind of like a reoccurring group of people that come all the time. And we have a lot of like casual conversations there. And
mhm,
we have a lot of like medical conversations or questions, but it's not intended for treatment. But I will tell you that one of my patients, I got the I was I got the notion to work her up for MS during one of the walks. It was
which
in
go ahead.
no, it was in our conversation that didn't really have anything to do with medical necessarily. It wasn't a doctor's appointment. It was just me listening to her talk about her life and what was happening to her, how it was impacting her. And I had one of these moments. Huh.
Hmm. Sounds like neurological
Uh-huh.
involvement, right?
Uh-huh. And lo and behold, ta-da, years and years
Wow.
of this slow progressive neurologic degeneration that's it's since figuring it out it's take the critical tipping point, but I mean I'm just amazed. We need to listen more. We just need to
Yes,
listen more. Okay.
absolutely.
All right, so let's bring it back. So reframing this, you're not broken.
Yes.
I repeat, you are not broken. You're in a transition. Okay.
Mm.
I don't know which transition you're in right now. I'm in perimenopause, and everyone's transition doesn't look the same. And I've joked with my friends. I love my 40s. And I think there's a lot to that, and I'm not going to just attribute it exclusive to perimenopause, but it does fit with this. It's a time for redefining. Things are different. Reset, redefine your boundaries, redefine what's important. Who are you in your body? What does that look like? What you thought you wanted in your 20s and 30s is not the same as your 40s and 50s.
Mhm.
Allow that to be true because it is, right?
One thing I've also noticed working with women that are approaching menopause is it's almost a time for them to tune in more to their body, because their body is yelling at them so loud via their symptoms.
All right, let's resume. All right, so you were saying that a time, just start over of
Yeah.
what you were
So
saying.
one of the things that I have just noticed working with women that are perimenopausal is this is almost a time, a forced time for their body, or by their body, for them to reset and like assess who they
Yes.
are, right? Hear
Mm,
what their body like, and almost tune in. Because
yes.
one of the things that we will probably talk about in a later episode of this is how we're so busy.
Yes.
Right? And how our society has kind of conditioned us to ignore ourselves and focus on doing all the things that we got to do right now, because everything needs to happen right now. And if we're talking women, she's in a gajillion roles. She's a woman
Yes.
herself, right? She
Mm-hmm.
may be a mother, she may be a wife or a partner, she's an employee or an entrepreneur, or she's in a really high professional role. And so there's just all of
Or a
this.
caretaker of aging
Yeah,
parents.
and definitely a kid. Come
Yes.
on. I'm glad you said that,
Yes.
because that's me.
Yes. Yes. And that's so many of us in this perimenopausal phase. So there's a lot of changes happening both in life and hormonally here. So let's not dismiss that. Right.
Yes. And
Um,
so, like you said, this is why it is important to take the opportunity to care for yourself so that you can do the things that
mhm.
you need to or want to do, but also so that you can, like you said, create new boundaries, learn what your body is trying to tell you, and to shift in order to thrive through perimenopause and menopause and not just like get through it, struggle
Yes.
through it.
Mm-hmm. It's not, it doesn't have to be like, you know, the end of the road.
It is not the end of the road. And
In
that's
fact,
the
it
other
isn't.
thing
Yes.
too. It's such, there's a little stigma like, oh goodness, right? I'm about to start rotting now because I've gone through perimenopause or menopause. No,
I
depending on,
cannot wait to get there. I mean, I can wait, but I'm just looking forward to being done with my periods. Okay. Like without having to intervene.
well, we talked earlier about average age, right? Being about 50, 51.
Mm-hmm.
And so it's not the end of your life. You
Mm-mm.
still got at least a good 20, 30, 40
Mm-hmm.
years, depending on.
But you know what we didn't talk about? And well, I'll say some of this for our next episode. And so I guess I'll kind of tease that here is there are risk factors that change too, right?
Yes,
So it may not be the end of your life, but if you don't do some things, you can prematurely accelerate the end of your life, right?
correct.
So where you're going to see greater risk of cardiovascular disease and stroke for women in the postmenopause menopause phase because of that drop in estrogen. Estrogen is protective. You're going to see more metabolic disease because of declining muscle mass, and again, declining
Estrogen.
estrogen, right? Because your metabolism.
Now I'm gonna
So
stop you, Doc. Don't give them no more.
okay, I'm done. Sorry,
But
I'm done.
she's 100% correct. There are things that you need to keep in mind, and ideally some changes that you make to
Hmm.
ensure that you help your body function optimally and you're
Right.
able to live a good.
And you need to make sure you're keeping up with your screenings and being
Yes.
proactive.
Yes.
Um, and there's things that you can do with your doctor to not just be reactive. You can predict if you're heading towards some of these conditions earlier. So there's additional testing that's often covered by insurance, by the way,
Yes.
that you can do. So if your doctor is not being more proactive with you, encourage you to have those conversations. You can also, again, schedule an appointment with one of us, and we're in Grand Rapids.
Yep.
We
And
haven't,
virtually.
and virtually. I was gonna say I haven't expanded my service, but I guess I could
You sure
beyond
could.
beyond. Yeah, I guess I could. So in any case, we're so excited to be able to share this information. If you can't tell, we're very passionate about it. So our next episode, we are going to share practical tools for you to manage your hormone shifts, your symptoms naturally and through lifestyle. Okay. There's a lot that you can do that does not necessarily require medications or even hormone supplementation. There are some hormone things you can do or supplements you can use to enhance. We'll tell you some of that, but not all of it.
Mm-mm.
Mm-mm. Gonna have to come to our workshop for that.
That's right.
So if you have not already shared this podcast with someone else, please share it with a friend, download. Maybe we'll make this handout or something like this downloadable. That might be a good idea. Some simple download that shows the fluctuations. Um, and you can sign up to be a regular listener. You can join our podcast community. So if you'd like to do that, there will be links available for you to do that. Check out my website for Lifestyle MD, so AngelaAndrewsMD.com. Dr. Carrie, where would you like to direct our listeners?
You can visit my website, which is vibrantwellnessmi.com. MI is for Michigan. Or you can find me on Facebook or Instagram at cdennynd.
Yes. And likewise, Instagram Lifestyle MD. And also for my practice, it's Seeds of Health Direct Primary Care or SOHDPC.com. So thanks again for joining us, and tune in next time when we cover how to manage your symptoms naturally. Bye.